so here we're gonna continue with this one here. So there was a disconnection here. So this everything here is meant so that you can follow me and so that I can encourage myself to read, because it's just hard to start reading. But since I'm doing this recording, then the reading is kind of it's kind of motivate me to read. So here, so we talk about that one. So this will happen at the other side too, but with the other side, this going to be the right lymphatic duct. Here is the right lymphatic duct. Here is the right lymphatic duct is going to do the same thing, but this is the thoracic duct. So the thoracic duct is on the left, thoracic duct. But here, this is the right lymphatic duct. So that is the difference between both of them. So that one is going to drain in the same area. So this is going to drain in the same area. So this is important. That's why when there is the this one here, which is the tumor that is going to happen in this area, is going to occlude, and it will cause the edema in those areas. So I think we're gonna see it at some point, somewhere. We're gonna see that at some area somewhere. So here it is. Though here is another one. Let me open this up and then we can see it here better. So here, this one here is going to talk about what? So this is talking about, okay, so this is the how they're showing the cisterna. This is the cisterna, and this is the thoracic duct. The thoracic duct is going to start here in the bottom on the left side, and on the left side is going to go to the same area, which is the jugular vein and the subclavian. This is the angle between the meeting of these two, and then the same thing on here. This is the internal jugular vein, and the subclavian vein, and then where they meet, that will be the right lymphatic duct. So return to the lymph to the venous system from the upper right quadrant. From the upper right quadrant. So here, this area is just this quadrant. It's going to be only this half. But this one here, the thoracic duct, it will take from everywhere. So it will take from everywhere, as you can see here. It's taking from here below the diaphragm. It's taking from the area from the feet and everywhere. It's taking from what comes from the arm, and then everything here is going to return to this corner here. Okay, but that is this is the thoracic duct. But here the right lymphatic duct is just going to drain this quadrant, which is coming from the arm, coming from the breast, coming from the head on that side. So this is what they're showing right here. This is what they're showing right here. So this area here, that will be the right thoracic duct. But this one here, this is going to be the not the right thoracic, the right lymphatic duct. I put the right thoracic, but it's the right lymphatic. This is a lymphatic, right lymphatic duct. Okay, lymphatic duct, and this is the thoracic duct, because there is a difference between the two. This is the thoracic duct on this way, and this is the right lymphatic duct. Okay, so in here, I'm going to remember it that way. So I'm gonna have to delete this area here. So that is here. So this is this area here. That one is gonna happen there. So now let's just to read the rest of the stuff that are happening here. I think okay, so let's just I don't think I need all this details and all this stuff, so let's just leave these details away and see here. This is the same thing we just talked about. So if you see here, this is the right lymphatic duct, but this is here the thoracic duct. All this is the thoracic duct, and that's it. So that is this here is the same thing. We have the cisterna, we have the thoracic duct going up there, and then we have here, this is the superior vena cava, and the superior vena cava here, which is the meeting of these two together. going, this is the meeting of these two together, they go to the superior vena cava and go to the heart. Okay, so and here I'm just gonna read this loud quickly so we can remember. There is the severe, I'm not gonna read it here because there is a better one that have more information that I might need. So here, this is the mastectomy. Okay, so we're talking about the mastectomy. In the mastectomy, what do we see? What do we see is that during the mastectomy, what are you gonna see? Let me take this stuff here. Let me take the blue. Let me take the mm, the green. Okay, so this is the radical mastectomy. In the radical mastectomy, what you're going to see, the radical mastectomy, a more extensive surgical procedure. So involve the removal of the breast. So the pectoral muscles, the pectoral muscle, fat, fascia. So let's see what is being removed. There is the pectoral muscle, there is the fat, there is the fascia, and as many lymph node as possible. Okay, so there is fascia, lymph node, fat, and muscles in the axilla. Okay, here in the axilla. So all this in the axilla here, everything in this area is going to be removed, but this muscle also is removed. So that is possible in the axilla and the pectoral region. So this is the pectoral region as much as you can, and then the axilla as much as you can. So during the radical mastectomy, the long thoracic nerve, remember that long thoracic nerve, this is the one that comes, the serratus anterior, that is what we call salt. That is what we call salt because the serratus anterior muscle and the long thoracic nerve. And this is the long thoracic nerve, the serratus anterior. This is what will allow you to pick up your arm. So this is, if this is the arm, you can pick it up above. So this is the horizontal line. This is a 90 degree. You're going to pick it up above the 90 degrees. That is the serratus. And also we use the trapezius. We can do the same thing with the trapezius also. So let's keep going here. So here, what is so this is during the radical mastectomy. So the long thoracic nerve may be lesioned during the ligation of the lateral thoracic artery. So this is the lateral thoracic artery is going to be right there, and the long thoracic nerve is going to be there. So it may be injured. Okay, the lesion to the lateral thoracic artery a few weeks after the surgery. So the female may present with the wing scapula. So the wing scapula, we have the wing scapula somewhere, and the weaken in the abduction. So remember the abduction above the 90 degrees. So this is the serratus anterior is going to raise your arm above the 90 degree. So this is the serratus anterior muscles. So paralysis. So the intercostal brachial nerve. So this is intercostal brachial nerve may also be damaged during the mastectomy, resulting in the numbness of the skin of the medial arm. So this is, let me do this one here. So this is the medial arm. Here is the medial arm. So I'm going to just do it like that. Here is the medial arm. I'm going to do it in red. So here is the medial arm. So this is what can happen with the medial arm. Here is what can happen with the serratus, because there is, here is the serratus muscle is in that area. So that is going to happen. So the serratus, and then what is the medial, the intercostal brachial nerve. So this is the medial, here is going to be the intercostal brachial nerve, this one here. So this is this one here, intercostal brachial nerve. Intercostal brachial nerve, that is going to be the sensation to the skin of the medial arm. So this is the medial arm. But if it is the serratus anterior, which is the salt, which is the long thoracic nerve, that is going to cause the inability to is going to cause inability to raise the arm, and then the winging of the scapula. It's going to cause the winging of the scapula. Yes. So that is the long thoracic. So where is the winging of the scapula? I think I saw it somewhere here. The winging of the scapula. So oh, I'm not gonna go there because I'm going to the I'm going to the wrong direction. So it's gonna so I'm gonna have to remember this one. That's where I'm starting. Okay, so we're done with that one. So let's go to the next one, which is here the breast infection. The breast infection, there is a mastitis. Mastitis is an infection of the tissue of the breast that occur most frequently during the time of the breastfeeding. Okay, so the first 1 to 3 months after the delivery of the baby. So this infection causes the pain and causes pain, swelling, redness, and increase the temperature of the breast. So it can occur when the bacteria, often from the baby's mouth, enter a milk duct through the crack in the nipples. So there are cracks in the nipple. So this crack, through these cracks of the nipple, it can cause the bacteria from the baby's mouth to enter the breast. So it can occur in women who have not recently delivered, as well as the women after the menopause. Okay, who has not recently delivered, so it can happen in any woman. Menopause, recently delivered from the baby, and the other one, and also from the menopause. So that is going to cause the mastitis. Okay.